afternoon. How are you? Well, good afternoon. Thank you for being here. I'm pleased to have this opportunity to share with you the details of Bill 17, the Canadian Centre of Recovery Excellence Act 2024. Over the past 5 years, our government has worked hard to change the way we respond to mental health and addiction challenges in Alberta. We know this is important as the deadly disease of addiction has ravaged our communities and broken up families and taken the lives of too many Albertans. Additionally, mental health challenges have been on the rise, especially among younger Albertans, which is a concern for something we are committed to responding to it. Through Recovery Alberta model, we have been proud to expand the addiction treatment capacity of more than 10,000 spaces since 2019. This number continues to grow as we have opened 2 new recovery communities with 9 more on the way and 5 in direct partnership with Indigenous communities. We have pioneered the most robust program anywhere in the world to prescribe opioid agonist therapy through the virtual opioid dependency program right here in Alberta, which currently provides more than 8,000 individuals with addiction treatment each and every day. Also, included in the Alberta recovery model is our focus on mental health, giving every person the opportunity for wellness through recovery. The truth is, recovery is much more than sobriety. Recovery is pursuing a path of purpose and fulfillment in our life, something I believe every person deserves to know as a possibility. We have expanded services through supporting same-day counseling anywhere in the province in partnership with Counseling Alberta and dialing 211 to get access to that. We significantly increased the number of youth served with the mental health programs within our schools, connecting them with clinical supports while continuing their education. This evidence-based approach we have taken comes from working with world-leading experts in the mental health and addiction field. We began first with the Mental Health and Addiction Recovery Advisory Panel, and then created the Recovery Expert Advisory Panel with local, national, and international experts in the field. One of which I will highlight is Dr. Keith Humphreys, who previously chaired the panel and now works as a drug policy advisor within the White House for the third time in his career through multiple administrations. Our plan is not ideologically driven, but instead human-driven. Driven by our belief that recovery is possible and there is hope for anyone suffering from the deadly disease of addiction or facing mental health challenges. We want to continue building the Recovery Alberta model and making improvements to mental health and addiction services within our province. And to that end, we are establishing an organization which will be known as the Canadian Centre of Recovery Excellence, which I announced last week with Premier Smith. This organization will be designed to evaluate programs within our recovery-oriented system of care and develop recommendations on where improvements can be made. They will be responsible for digging into what the best practices are from around the world and responding to the deadly disease of addiction or mental health challenges. The establishment of CORE only continues down the path of strengthening services delivering mental health and addiction care for Albertans. Similar to the Health Quality Council of Alberta, CORE will provide insight within the healthcare system and evaluate our performance. This year, we are committing $5 million to support the establishment of CORE and to help them begin their work should this legislation pass. Positive change only comes when everyone rows in the same direction. I believe the establishment of CORE is a step to making that happen on an evidence basis. Last week, I was proud to stand with 2 of my colleagues from Ontario and Saskatchewan as we announced a partnership in building a system that focuses on recovery in our provinces. Together, we will begin to see a nationwide response in making recovery possible, not only for Albertans, but for all Canadians. The privacy of Albertans is a top priority for us as we refocus our healthcare system and the establishment of the Canadian Centre of Recovery Excellence. Our government is taking steps to implement the strongest privacy protections and the strictest penalties in Canada for any violation. They will be governed with the same standards as CORE will be governed with the same standards as a Healthcare Quality Council of Alberta, which means protecting personal information of individuals receiving services through our healthcare system while being evidence-based as a government. I would like to make clear that as a healthcare body, CORE will be subject to strict privacy rules under a FOIP legislation and will be required to establish a board of directors who will be accountable for compliance through these privacy protections. This is a positive opportunity for our system to move forward to continue in Alberta as national leaders, building in a recovery-oriented system of care. With that, I want to say thank you, and I'm happy to take your questions.
All right, thanks everyone. We'll start with questions here in the room, seeing all of you with your questions. Why don't we start, I saw Janet's hand first, so we'll start with you. We'll do one question, one follow-up.
Okay, so, I mean, some would argue that your government has a vested interest in proving that the Alberta recovery model is effective. So why should the public feel confident that any research conclusions that are coming out of this core entity, which is funded by you, controlled by you, why should we trust that anything that comes out of it is objective, fair, independent from government intention?
Right. This government has an interest in helping Albertans, no matter their circumstance, and every single one of them deserves an opportunity to a healthy, fulfilled life, which is why we're moving forward with the recovery model. We need to be able to evaluate that. This body will allow us as a government to reflect in the evidence whether or not we are getting the results that Albertans expect of us. And so if it's a partnership, for example, in research, of course, it will need to be published and peer-reviewed, as would be expected with that partnering institution. If it's an evaluation of our system, then of course we need to know, is it working or is it not? And I can tell you right now that it's absolutely essential that we be based in evidence. And that's why, without CORE, we're not going to be able to do that as effective as we can with the Centre of Recovery Excellence.
You can go ahead with your follow-up.
I just need to switch gears for my follow-up. There's a City of Edmonton report that's just come out today. In 2023, the city spent $9.1 million on direct costs of addiction and mental health needs. Things like peace officers responding with Narcan, firefighters responding to poisonings. So what are your plans to try and reimburse the city for some of those expenses since they fall under provincial jurisdiction?
Well, as you know, our government has already partnered with the City of Edmonton and Calgary, providing new sheriffs for dealing with the crisis that they're facing, and the government of Alberta provides over $3 million in funding for naloxone kits across the province that we distribute as liberally as possible, especially in those communities that have the highest need. I'll be waiting to hear from my municipal counterparts if they have any more requests on those funding items that I have within my jurisdiction.
Hop over to Chelan.
Thank you. Is there anything specifically in this legislation that obligates CORE to publicly release the research they conduct? If so, how? And if not, who is ultimately responsible for deciding when that research gets published? Is it you? Is it Dr. Dave?
Mm-hmm. So obviously the research program that we have, I approve on the advice of the Chief Scientific Officer. When we partner, as we would with any other institution, when it comes to research particularly, the expectation is that it's going to be published, of course. I mean, these independent institutions, if we're talking about University of Calgary or Stanford or the Harvard Recovery Research Institute, all these bodies that we've already had some interaction with over the last 4 years as government would expect a publishing of that, and we'd be happy as well. We want to see the data and the conclusions of the research published. When it comes to system evaluation and advice of the minister, we're going to be as transparent as we can within those very high and strict privacy protections that we're required to follow within our act, similar to the HQCA is.
Do you have a follow-up?
Yes, yeah, so just in terms of clarity, I guess, on that first one, then my follow-up, the expectation is that it would be published, but nothing in the legislation specifically cites that it has to be?
Well, I don't know a public institution that does research that doesn't publish their data. If we're going to partner with the U of C or the Harvard Recovery Institute for research, then it's going to be published. So I just, yeah, that's the expectation with those institutions. It's what I expect is going to happen. I don't know how it could not be published if it's going to be partnered with an independent institution.
And then just my follow-up. We heard in the tech briefing that CORE activities will be directly aligned with the goals and priorities of the government of Alberta. I guess just speaking a little bit to Janet's question, you have said that something like safe supply is not on the table for your government. Will something like that still be explored in the research, though?
Absolutely, it can be explored. It's a part of the addiction and mental health space, a public policy on offer to Canadians and Albertans. As part of this conversation happens, CORE is going to have to inform that.
Okay, Catherine, go ahead.
And a similar question, but on the data rather than the research. I also see zero requirement for data to be shared or made public, and don't really see a mechanism for that to be done in regulation. So I'm wondering, in terms of the aggregated data, will that be made public, that you're using to make your decisions?
Yeah, I don't think we want to have a blanket where we just publish data no matter what. Obviously, it needs to be subject to privacy impact assessment, needs to be subject to the FOIP Act, needs to be subject to those high standards we have. But within that, my expectation, and I'm happy to, we look at ACES, for example, it's the most transparent accounting of any kind of platform of its kind across Canada. We're going to keep that up. I want to see as much data that can be in the aggregate shared with the public, published. And that will be my intention as minister, to continue to see that data inform not just my government, but Albertans, the media, and civil society, and all of our partners with what they can get access to within those very strict privacy regulations.
Okay, but will we see any expanded data on that surveillance use dashboard as we take a more holistic approach? So for example, will we see overdoses of people who have relapsed after treatment? Will we see some of those social indicators, people who have connected with family, people who are employed after going through these programs? Will we see, like, what data are you going to be looking at?
Short answer, yes. Longer answer, yes, because what we're doing with CORE is able to get information not just from health, when it's in an aggregate form, when it's in its appropriate for disclosure form, it's going to be connected to justice, community and social services, health, of course, our Ministry of Mental Health and Addiction, so that we have a broad idea of a lot of those social determinants of mental health and addiction that lead to these kind of circumstances. It's going to be more accessible, and there will be more showing up on those platforms that you currently go to, for example, ACES.
All right. Michelle, go ahead.
Yeah, I just wanted to clarify with you about these partnerships between COREs and outside organizations, like to do research. So is there anything in the legislation that says it's only universities that do research? Is there anything that prescribes who can partner with COREs on research?
So first of all, I'll answer the broad question of, of course we'll be doing research. The lion's share of the work done at CORE is going to be looking at a system analysis in terms of both our system within for evaluation, but also a systematic review of the current evidence that exists in research that is already being published, so that we can take account of that broadly. But when it comes to individual research projects, there's nothing that says it needs to be a university, but obviously on the advice of the Chief Scientific Officer and approved by the Minister, we're going to want to make sure that it's an accredited institution in an important way that has some meaningful standards of its own and credibility in its own space.
Why not prescribe that it's universities? Because you're leaving yourself open to accusations that, you know, I mean, there's a lot of people that set up institutes that have maybe somewhat questionable backgrounds, right? So why not just say, no, it has to be an accredited university that does this research with us? Why isn't that in the legislation?
Well, there are a lot of other bodies, research institutes, think tanks, et cetera, internationally. The Manhattan Institute in the United States is a good example.
Manhattan Institute has a very definite point of view to it.
Sure, and I could say the Simon Fraser here in Canada. You could think of the Broadbent Institute. There are numbers on all political sides of the spectrum that you could possibly partner with. And so we want to make sure that we are able to partner with the body that makes the most sense.
But that would make people think that you're trying to produce propaganda then, right? Like if it's not with a university.
I'm sorry,
I mean,
two questions. So one, you think universities aren't capable of having a political bent? And secondly, all institutions are?
No, I mean, there are universities that certainly have political bents to them as well.
Okay, so would you say that they're propagandists as well?
No.
Okay, so then should we ban universities from partnering as well, Michelle?
I am saying, Minister, that it's pretty clear that your government has a very, very definite direction to where you're taking this, right? It's all recovery. You don't care for certain types of harm reduction. So that I think that it goes to Janet's question: is how do you address the perception in the public that this is basically like the Canadian energy war room too?
I'm just going to jump in. We'll let the minister answer the question, then we're going to jump to the phones.
Okay, so I'll say, first of all, this government will not participate in safe supply if that's the so-called harm reduction you're referring to. It's abundantly clear we won't. But this government has a number of different programs that support what people call harm reduction, including the naloxone, funded over $3 million a year, the virtual opioid dependency program when it comes to the DOORS app, when it comes to drug consumption sites, and we want to see evaluation, positive or negative from that. And we'll partner with any body that helps us in the estimation of the minister and the chief scientific officer, leading us to that end.
Okay, we're gonna jump to the phones and then we'll come back to the room. Operator, can you put through our first caller?
Thank you, Mark Valani, CTV Calgary.
Hi, Minister. I'm wondering if you can speak to claims from the United Nurses of Alberta that negotiations were not done in good faith and contract rights weren't offered to transfer future employees from AHS to Recovery Alberta. I wanted to get your insight into how the province can help us maybe remedy this situation.
Okay, thank you for the question. I'll say, first of all, I'm very, very proud of all the work that frontline mental health and addiction health professionals do. And I know that negotiations are ongoing between AHS and the respective unions of those healthcare professionals. So I need to let that play out in its appropriate space. I'll tell you that I plan to have the terms of employment continue on without change going forward for healthcare professionals as they come over. We particularly announced this on April 2nd with an implementation date in July for that 3-month window of having an appropriate and fulsome consultation process with the healthcare professionals, frontline workers, and their respective unions who represent them. So I want to work positively with them. I think that there is an opportunity for us to find common ground here. When I speak to frontline healthcare workers, they want the same thing I do, and we connect in wanting to see more and increased mental health and addiction support, and this shift allows us to do that in a serious way, and I want to do that in a thoughtful way in partnership with frontline workers and their respective unions.
And do you have a follow-up, Mark?
It's my understanding that the roles of nurses transferred from AHS to Recovery Alberta won't be changing at all, just the name of the employer itself. So it just begs the question, why create Recovery Alberta? How much more will this cost? So does not just add a little bit more red tape and bureaucracy to these kinds of addiction support?
Yeah, fair question, Mark, and I'll tell you that the goal of the government is to put an even more heightened focus on mental health and addiction. So 5 years ago, we didn't have an associate ministry, and then we had associate ministry elevated by Premier Smith to a full minister a year and a half ago, and we see now a budget line which didn't exist 5 years ago to $1.55 billion, and we've taken the work needed over the last 4 years to create a focus on mental health and addiction. AHS does great work. It's an organization of approximately 120,000 individuals. Mental health and addiction is a big enough priority policy for us to no longer ask AHS or government to do it off the side of its desk. This needs to be centered and focused. Having a cabinet minister at the cabinet table focusing on this is what Albertans, I think, expect of us, and having an organization that doesn't, do mental health and addiction between other key healthcare, whether it be emergency rooms or surgeries, instead focuses primarily on it, allows us to better serve Albertans and make sure we have policies that are effectively helping Albertans with the tax dollars that we spend on their behalf.
And we'll, operator, put through our next caller.
Thank you, Alana Smith, Globe and Mail.
Hi, thanks for taking my question. A bit off topic, but also related. This morning, the Office of the Child and Youth Advocate released an update on investigative reviews. I think it was 48 young people who died while in government care or receiving child intervention services. And one of its findings is that one of the most frequent causes of death was drug poisoning. So I'm wondering, what is the government doing to meaningfully address this problem, especially to protect youth in its own care from dying this way?
Yeah, thank you for the question. Something that I think touches every Albertan's heart whenever we see a youth affected by the deadly disease of addiction or those around them who are affected by addiction. And so a number of things we've done, first of all, is we've expanded the virtual opioid dependency program to youth receiving intervention services as well. And that was a big step for us to make sure that they can get access to it if it's an opioid-related addiction. Of course, we've also tried to massively expand capacity province-wide. Many of the youth you mentioned are able, over the age of 18, to get access to our recovery communities, 2 of which are built, 9 more in process, 5 of which are in partner with Indigenous, who, as you know, are disproportionately represented amongst those who are affected in that report. And then I'll also say that it's very important for us to recognize that there's intergenerational trauma and intergenerational effects of addiction. Many of the youth who are affected also had parents who suffered from addiction as well. And so trying to cut that cycle of addiction, and make no mistake, trauma lives in addiction. To cut that cycle of addiction is one of the most important things we can do, and that's why our recovery-oriented system of care is trying to get resources to those who struggle from addiction. So those are a number of some of the initiatives we're trying to take to move forward.
And do you have a follow-up, Alana?
I do. I am hoping just to clarify my first question. You mentioned recovery communities versus are 18 plus, so maybe you speak really specifically and also to youth in care, just not youth in general. But my second question is that during this press conference, you've made kind of a conflicting statement. At the front of the press conference, you said absolutely through core safe supply can be explored. But then later in the press conference, you're saying this government will never, it will not participate in safe supply. They've made you've made this stance very clear. So are you admitting already that regardless of what evidence may show over time through core, that the government is unwilling to look at or consider approaches that is, I guess, contrary to its current path forward?
I would say very clearly that whatever evidence comes out of the best possible research is what I as a minister and we as a government have to be listening to. There is no evidence to suggest anywhere that I know of that safe supply can help those who suffer from addiction in a meaningful way, and as a broad policy setting has proven to be devastating and a disaster for the very few jurisdictions that have adopted it. If evidence is presented to me on any issue, I need to seriously consider that, and some of the purpose of doing the systemic review of what evidence there is in existence and evaluating our system will be to be responding to evidence brought forward. But to be abundantly clear, the reason I take the position I do around safe supply is that it's abundantly clear that it's a disaster, that handing out drugs to those who are in the midst of an addiction crisis for our society is not helpful. If there is meaningful, substantive evidence to say otherwise, of course I need to review that. But CORE's purpose is going to be to evaluate our current system and what we're doing, and also look at possible partnerships to see if there is directions we need to go in.
All right, we'll come back to the room here. Jonathan, go ahead. We'll let Lisa ask her question and we'll wrap up.
Okay. Jonathan Bradley, Western Standard. Thank you for taking my question. So the Canadian Centre of Recovery Excellence is going to be a Crown Corporation. Why did you feel it was necessary to make CORE a Crown Corporation?
Okay. Well, first of all, CORE is effectively a parallel organization within mental health and addiction to HQCA, which is also a Crown Corporation. By making a Crown Corporation allows us to have a board that is responsible for the delivery of its mandate, for its evaluation of the system, for any possible partnerships it may have in research, and it also allows information to flow in that appropriate high standard that we have around Health Protections Act, privacy and impact assessments, and FOIP between government bodies. So that means collaboration with AHS, Recovery Alberta, the ministry, other ministries as well. So the right mechanism for us to move forward was a Crown Corporation.
Okay. While the Alberta government has committed to focus on recovery, safe consumption sites remain open across the province. Where do you stand on banning safe consumption sites?
Well, I mean, obviously I just passed a budget that has funding for more drug consumption sites in them. And we also are listening very deftly to any feedback that we get from local community. For example, if we look at Red Deer recently had a very lengthy debate on this and have committed to taking their input very seriously on a path forward. So I'm very happy to work with local community members, and if municipalities give the provincial government feedback, it's something that we have a responsibility to take seriously.
Thank you.
All right, Lisa, go ahead.
Thanks. I want to go back to the UNA labor complaint a little bit. They're obviously alleging that you're bargaining in bad faith, that the government interfered by notifying employees first before the union, and they say that members are able to elect whether to transfer to a new employer at all. So I'm wondering, with your legislation, you're going to have to dictate a new employer, I would presume, in the legislation. So doesn't bargaining need to start over completely? These members?
I'll let AHS and the bargaining leadership team address the specifics when it comes to the negotiation. Obviously, with those negotiations ongoing, I want to make sure that all the appropriate channels are respected there. I can tell you from my perspective as the minister, as I establish this new organization, I see a huge opportunity for collaboration with those frontline workers, and I believe also with the union and their leadership. I see the shared interest in delivering better mental health and addiction care to Albertans, and so I want to look at ways that we can find common ground there. And I'll tell you that the process that as we continue down this path, generally from 2019 to now, it informed my thought process in making sure that we had that very substantive 3-month consultation process. I didn't want to see a lot of upsetting the apple cart. I wanted to see continuity. I wanted to see partnership and positive collaboration. And I'm confident that given that timeline and my interests and the other side's interest to want to see a positive end, that we're going to get to that.
On that point, I mean, you're in the middle of a labor dispute, they've just filed a labor complaint. They say that there was no consultation ahead of this announcement. They learned when the public did, the same day is when you finally sat down with them. And that essentially you put the cart before the horse. So why should they trust that you will take any of their feedback into consideration in this collaboration on implementing it when you've made these decisions and you made the announcement before collaborating with them in the first place? Why should they take this in good faith?
I'll say in a broad sense, not specific to any complaint, that it's been very clear what government is planning to do ever since we made an announcement before Christmas last year that we were moving towards this direction. There's been no question publicly that that was the case, and everyone was informed of that. I'll say as well that that I have the government's involved with over 50 town halls with frontline workers and the general public. I've been involved by having conversations with frontline workers on a daily basis in terms of what we need to do to get the general creation of this organization right. And if you're talking particularly about consultation in respect to union and labor negotiations, I'm going to have to let the appropriate bodies, AHS, and the unions have that discussion around official consultation.
Thank you, everyone. That wraps up today.